What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos come in every week. You don't want to miss them. In today's video, I'm going to talk about something that goes on in your medical training, whether that's pre-med, medical school, residency. It happens. It's called pimping. And I'm not talking about the pimping that you may think that it is, like the old school pimp who walks around with the hat to the side, a nice 4-piece suit. Is that even a thing, 4-piece suit? I think 3-piece, maybe 4-piece, but with the cane. I'm not talking about that type of pimping. I'm talking about when the word pimping is used, and it's used in medical school. We use it at Georgetown. We use it here in residency. Pre-med students may get pimped. To be pimped or pimping means that you're asked a question. Say, for instance, you're rounding in the hospital, which means you're going around to see your patients with your team. It may be staff physician, 1 or 2 staff physicians, maybe 4 or 5 residents, a couple medical students, maybe some pre-med students, college students. And you're going around and you're seeing patients from door to door, and the patient that you go see has jaundice. Jaundice means a yellow discoloration of the skin, which can be caused by a number of different things, one of which is the liver. When your liver fails, your body builds up bilirubin, and then you see it in like the sclera of your eyes. They can have some other signs and symptoms of liver disease. So your attendant, he may ask the resident, usually starts off at the resident level, and then he may ask them a question. What is the differential, which means some possible causes of a patient that has this jaundice? What is the differential of this patient's jaundice, Dr. Lee? So that's pimping, when they ask you a question. And in front of everyone, you're expected to know or come up with a plausible answer of what you've been asked. So you usually start off at the resident level. At the resident it usually starts off at the medical student or the lowest level. The medical student doesn't know it, they may ask the 3rd-year medical student, they may ask the 4th year. The 4th year doesn't know it, they may ask the intern. And then it goes all the way up until it gets to like the chief resident, and they look at me like I'm supposed to know the answer, but I may not know it at all. You may be impressed also by that I remembered what jaundice is. You know, orthopods, we do know other things besides just bones. So I remember a lot of my, my medical training, a little bit, not a lot. But that's what's called pimping. And there are certain rules to pimping that you must follow. Number 1 rule is that you cannot pimp up. If you're an intern or if you're a medical student, you can't pimp up to a 2nd-year resident or a 3rd-year resident and ask them a question. You just don't do that. Another rule is that when you're asked a question, you need to answer that question. Say, for instance, I asked a medical student, James, a question. Sue over here bet not answer that question. She cannot jump into place and blurt out the answer. You wait your turn. They will go around, they will ask everyone else if that question is not answered. So the next rule is that you need to come up with some type of answer. You can't just say, I don't know. If they ask you, I don't know, the translocation for synovial sarcoma, if you don't know the answer, you need to make up something, a plausible answer. You need to come up with something, but you should say translocation of X18. That's synovial sarcoma for you. So you need to come up with something. So those are the rules are pimping. Pimping is a actual term that is used in medical training. For medical school, we use it in medical school. They pimp you a lot in surgery. They may ask you the anatomy. They may point to a vessel or to an organ and say, what is this here? So, or while you're on rounds, or if you're in clinic with the professor, he may ask you a question. I think pimping is effective. Some people may not agree with that, because when I got pimped and I didn't know the answer, it's almost kind of humiliating in front of your peers. You don't want to be put on the spot, and you definitely don't want to know the answer. That made me go home and read a lot more. So I think to be prepared for your pimping in medical school, you need to read. You need to read up on your patients. You need to jot things down. I carried a notebook, and things or words that I didn't understand that I would hear throughout the day, I would jot it down and I would go home and read it again, or just read it briefly, because believe me, that information is going to come back over and over and over again. On my step 3 exam, my in-training exams, I saw questions from like organic chemistry. I'm like, what the hell is this? So pimping is a real word. We use it in medical training. I think it is effective. Some people may not agree with that, but you will get pimped along your medical career becoming a doctor. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.